Hey everyone, and welcome back to the EMT Spot's Blood Pressure Podcast. I'm Samuel Harrison, and I'm so pumped for today's deep dive. We're going to be tackling high blood pressure and low pulse. It's kind of strange, right? You'd think with high blood pressure, your heart would be racing all the time.
Yeah, you'd think so, right? It seems a little counterintuitive, but it's actually more common than you might think. And before we get into the why of it all, we need to start with what exactly we mean by low pulse, which doctors call bradycardia.
So bradycardia is when your heart rate is less than 60 beats a minute.
Exactly. And just for comparison's sake, a heart rate above 100 beats per minute is known as tachycardia. But let's get back to that low pulse, high blood pressure thing. So why aren't they always in sync? Well, think of it this way. Your pulse, or heart rate, is like the electrical system in your house.
Okay, I'm listening.
While your blood pressure is like the plumbing system, the electrical system controls how fast things work, and that can affect the pressure in your pipes. But things can get out of whack sometimes.
I like that analogy. Makes it much easier to picture. So what can cause this mismatch of high blood pressure with a low pulse?
Lots of things can contribute. One common culprit is the thickening of heart tissue. You see, if someone's had high blood pressure for a while, their heart's been working overtime. And to cope, the heart muscle can actually thicken.
But wouldn't a thicker heart muscle make the heart beat faster? I mean, it's stronger, right?
That's where the electrical system analogy comes in handy again. When the heart tissue thickens, it's harder for those electrical signals to travel quickly. It's like sending a signal through a thick wall. It takes longer. Those signals get delayed, and that slows down the heart rate.
So the heart's trying to pump harder, but the signals are getting stuck in traffic.
Yeah, that's a good way to put it. And then there are medications to consider, too. Some high blood pressure meds can also affect your heart rate.
Right, like beta blockers and calcium channel blockers, right?
Exactly. They're often prescribed for high blood pressure, and they work by slowing down the heart rate. It's like taking some of the workload off the heart, which helps lower the blood pressure.
Makes sense. Taking it easy on the whole system.
Yeah.
But injuries can also be a factor, right?
Mm.
The research mentioned brain injuries or internal bleeding around the brain can trigger something called the Cushing reflex.
Ah, yes, the Cushing reflex. It's a fascinating but serious physiological response. When there's increased pressure on the brain, your body basically goes into emergency mode. This results in irregular or slowed breathing, a decreased heart rate, and high blood pressure.
Wow, so the high blood pressure and low pulse are both symptoms of a bigger problem in this case, not a cause and effect situation. It's really important to be aware of these connections. But what about when the body is just trying to regulate itself? What about the baroreceptor reflex?
Right, the baroreceptor reflex is like your body's built-in blood pressure control system. Think of it as sensors in your arteries constantly checking your blood pressure. When it goes up, these sensors called baroreceptors tell the brain, and the brain tells the heart to slow down to try and lower that pressure.
So sometimes this combination could just be the body trying to keep things balanced. It's amazing how it all works. But I'm guessing there are other less common things that can cause this too, right?
You bet. There's sick sinus syndrome, for example. It messes up the heart's natural pacemaker, leading to a slow heart rate, which sometimes comes with high blood pressure. It's like the heart's rhythm is offbeat.
Okay, so it's not always as simple as we might think. What else should we be aware of?
Well, even something as simple as nasal decongestant spray can play a role. Phenylephrine, the active ingredient in a lot of over-the-counter sprays, can actually raise blood pressure if you use too much. And what does the body do? It triggers that baroreceptor reflex to slow the heart down.
Hold on. You're telling me my cold medicine could be messing with my blood pressure and pulse? That's kind of crazy. And didn't we read something about heart attacks? You'd think a heart attack would always make your heart race, wouldn't you?
Not always. While that's the common image damage to the inferior part of the heart during a heart attack, can actually slow the heart rate down. Sometimes even increasing blood pressure, especially for people who already have a history of high blood pressure.
Wow, there's a lot to think about here. So how can someone even tell if they have high blood pressure and a low pulse at home? Should we be checking our pulses all the time?
Well, checking your pulse is pretty simple. You can feel for the pulse in your wrist or neck and count the beats per minute. It's a good habit to get into.
And what about measuring blood pressure? Can people do that themselves?
Absolutely. Home blood pressure monitors are easy to find and give pretty accurate readings. But keep in mind, high blood pressure often doesn't have obvious symptoms, especially if it's below 180 millimeter Hg.
Good point. So what are some warning signs? When should someone call their doctor?
If your blood pressure goes above 180 millimeter Hg, and your pulse drops below 60 beats per minute, it's time to see a doctor. And if your diastolic pressure, that's the bottom number, is higher than 120 millimeter Hg, that's an emergency. You need help right away.
Okay, those are important numbers to remember. Are there any other symptoms that could mean something's wrong?
Definitely pay attention to things like chest pain, shortness of breath, heart palpitations, dizziness, confusion, or even fainting. And any weakness, numbness, or trouble speaking or swallowing should be taken seriously too. If you have any of these, especially with high blood pressure and a low pulse, get medical help right away.
This is all really important information, but before we go on, I think it's important to remember that blood pressure and pulse rate change naturally throughout the day. Things like exercise stress or even just sitting for too long can make a difference.
Exactly. It's about figuring out what's normal for you and what might be a sign of a problem. That's why regular checkups with your doctor are so important.
They can help figure out your baseline and spot any concerning trends. This has been really eye-opening, but we've covered a lot. Let's take a moment to process all of this. When we come back, we'll dive even deeper into high blood pressure and low pulse.
Welcome back to the EMT Spot's Blood Pressure Podcast. Before a break, we were talking about the connection between high blood pressure and a low pulse. It really shows just how complex our bodies are.
It is fascinating. We've learned about so many things that can cause this combination, like thickened heart tissue medication side effects and even just a simple cold medicine.
Yeah, and we've seen how the body tries to stay balanced even when things aren't quite right. Like with the baroreceptor reflex, it's a testament to how resilient the human body is.
Absolutely.
hmm
But as we've learned, it's not always a quick fix. So for our listeners who might be feeling a little overwhelmed with all this information, what are the key takeaways? What's the most important stuff to remember?
Well, first off, remember that high blood pressure and a low pulse can happen together, and it might be totally normal for some people, but it's
Yeah.
definitely something to be aware of and talk to your doctor about.
Right, because it can sometimes be a sign that something else is going on. It's
Correct.
like a little clue that something might be off.
Exactly. And that's why knowing your normal blood pressure and pulse is so important. Regular checkups can help figure out your gut line and catch any big changes.
And luckily, as we talked about earlier, there are easy ways to keep track of these things at home. Checking your pulse and using a home blood pressure monitor can be really helpful. It puts you in control of your health.
You got it. And don't hesitate to contact your doctor if you notice any strange patterns or if you have those symptoms we mentioned before, like chest pain, dizziness, or difficulty breathing. Catching things early can make a big difference.
This has been a really eye-opening deep dive into the world of blood pressure and pulse rate. I think we've all learned a lot today. Thanks so much for sharing your knowledge with us.
Happy to do it. I always enjoy explaining these complicated health topics and helping people understand how to take care of themselves.
We've definitely done that today. It's amazing how much power we have when we understand our health. But before we finish up, I have one last question for you.
Go for it.
With everything we've discussed about high blood pressure and a low pulse, what's the one thing you want our listeners to remember as they take care of their health?
That's a great question. More than anything, I want to emphasize the importance of listening to your body. Notice any changes that happen, whether it's a sudden jump in blood pressure, a consistently low pulse, or any other unusual symptom. Your body is constantly talking to you, and it's important to pay attention and ask for help when you need it.
That's such great advice. It reminds us that we're not just along for the ride. We can actively participate in our own health.
Absolutely. And remember, it's never too late to start taking care of yourself. Every step you take towards a healthier lifestyle is a step in the right direction.
Well said. This has been another great episode of the EMT Spot's Blood Pressure Podcast. Thank you for joining us on this deep dive into the fascinating world of blood pressure and pulse rate.
It's been my pleasure to share this journey with you and our listeners.
And to our listeners, we hope you found this episode helpful and informative. Be sure to subscribe to our channel for more insightful discussions on all things blood pressure. We'll be back soon with more deep dives into the latest research and expert opinions. But for now, stay curious, stay informed, and most importantly, stay healthy. We've learned so much about high blood pressure and low pulse in this deep dive. It's amazing how much there is to know about just these two simple measurements.
Yeah, it really does show how complex the human body is. We talked about how the heart works, how the body can regulate itself, all kinds of stuff.
And we learned that even though high blood pressure and a low pulse can sometimes be okay together, we really need to pay attention to what our bodies are telling us.
Exactly. It's all about knowing what's normal for you and when you should talk to your doctor. Catching things early can really make a difference.
This episode has been full of information, but if you had to give our listeners one last piece of advice, what would it be?
I would tell everyone to think of their health as a conversation, like a partnership with their doctor. Don't be afraid to ask questions. Speak up for yourself and ask for help when you need it.
That's a great way to put it. Our health is in our hands, but we don't have to figure it out all alone.
Exactly. There are resources and experts who can help us along the way. Regular checkups, talking openly with your doctor, and being proactive about your health are all so important.
Well said. Well, it's time to wrap up this episode of the EMT Spot's Blood Pressure Podcast. Thanks for joining us on this journey of discovery.
It's been great sharing this information with you and our listeners.
I'm Samuel Harrison.
And I'm Olivia Harper.
We hope you found this deep dive into high blood pressure and low pulse helpful and informative. Don't forget to subscribe to our channel for more great conversations about blood pressure. And please share this episode with anyone who might find it useful. Until next time, stay curious, stay informed, and most importantly, stay healthy.